Moldex Qualitative Bitrex Fit Test Kit Training Video. When issued a Moldex respirator, you must make sure your respirator fits properly. As part of a complete respiratory protection program, the Occupational Safety and Health Administration, OSHA, requires fit testing to be conducted at least annually. OSHA Regulation 1910.134F requires that the user be fit tested before being assigned a respirator. Prior to being fit tested with any respirator, you must have completed a medical evaluation. Equipment required: Moldex Bitrex Qualitative Fit Test Kit, Moldex Bitrex Qualitative Test Hood, Nebulizer number 1, Bitrex Sensitivity Solution, Nebulizer number 2, Bitrex Fit Test Solution, 2 sets replacement nebulizer inserts, Bitrex Fit Test Solution Applicator Tube, Bitrex Sensitivity Solution Applicator Tube, appropriate Moldex respirators. Bitrex Fit Test. Use any Moldex disposable N, R, or P series class disposable respirator or any Moldex half mask or full face respirator with any N, R, or P series filter. The proper fit of your respirator must be confirmed with a fit check before you wear the respirator in a contaminated atmosphere. Nebulizer pre-inspection and preparation. Remove the top half of the nebulizer by unthreading it from the bottom half. Use your index finger lightly push down on the atomizer to ensure that it is pushed down all the way onto the bottom half of the nebulizer. Inspect and ensure that the black O-ring is properly seated. Replace the top half of the nebulizer. Repeat for each nebulizer. Bitrex applicator instructions. Warning: when crushing the applicator tubes to release the product, it is important to wear protective gloves. It is also important to pinch the applicator tube to break the glass ampoule. Do not bend the tube. Preparation. Remove sensitivity solution applicator and/or the fit test solution applicator from its storage box. With the fill tip pointed upward, pinch along the full length of the applicator tube using your thumb and forefinger until glass ampoule inside of applicator tube is thoroughly crushed. Warning: it is important to keep the applicator tip pointed upward when pinching the tube. This is to prevent the solution from squirting out during the pinching process. Warning: do not attempt to remove the tip of the applicator. It contains a porous filter which is designed to allow the solution to pass through it while filtering out the glass ampoule particles. It is also not necessary to puncture a hole or cut the tip of the applicator. The applicator tip already has the proper hole size in it to allow the solution to squirt into the nebulizer. Remove the upper circular end cap from the nebulizer. Insert the applicator tip into the opening of the nebulizer. Squeeze along the applicator tube to transfer the solution from the applicator down into the nebulizer until the applicator is completely drained of the solution. Ensure that each nebulizer is able to produce solution mist by removing both the upper circular end cap and the lower rectangular breather vent plug and squeeze the bulb 4 to 5 times. If solution mist is not visible or seems very weak, carefully, so not to spill the solution, remove the top half of the nebulizer by unthreading it from the bottom half and repeat. Note: it is recommended that the end cap and breather vent plugs be replaced back on the nebulizer until the test is ready to be performed. Use the foam cushion insert in the fit test kit to hold the nebulizers upright. Once the applicator solution has been drained into the nebulizer, it can safely be disposed. Taste sensitivity screening. This test is done to ensure that the person being fit tested can detect the taste of Bitrex at sufficiently low levels to make the fit test valid. Ensure that the test subject does not eat, drink, smoke, or chew gum for 15 minutes before the test. Explain the screening and fit testing procedures to the subject. When the subject is ready and has been instructed on the testing procedure, begin by removing both the end cap and the breather vent plugs of the test nebulizer. Instruct the subject to put on the hood without a respirator. Position the hood forward so there's about 6 inches between the subject's face and the window. This is especially important for the fit test. It allows free movement of the head when the subject is wearing a respirator and helps ensure even dispersion of the aerosol around the face seal area. Instruct the test subject to breathe with their mouth slightly open and tongue extended. Using the nebulizer labeled Bitrex Sensitivity Solution, inject the aerosol into the hood through the hole in the front of the enclosure. Inject 10 squeezes of the bulb, fully collapsing and expanding the bulb on each squeeze. Ask the subject if he can detect the bitter taste of Bitrex. If the subject does not detect bitter taste, inject an additional 10 squeezes into the hood. If the subject still does not detect bitter taste, inject an additional 10 squeezes for a total of 30 squeezes. If 30 squeezes were inadequate to elicit a response from the subject, this subject cannot be fit tested with the Bitrex test. Another fit test method must be used. If the subject could detect bitter taste, the number of squeezes required to produce a taste response should be noted as 10, 20, or 30 squeezes, even if subject tasted the Bitrex on a number of squeezes other than multiples of 10. Remove the hood, wait a few minutes to give the subject time to clear the taste from his mouth, before proceeding to the fit test. A drink of water during this time will aid in removing the bitter taste. Use a paper towel to wipe the subject's mouth of any residue. Also wipe mustaches. Have the test subject put on and adjust the respirator per the instructions provided with the respirator. Have the subject select the size respirator that provides the best fit. The subject may find a mirror useful in the adjustment process. The subject should wear the respirator at least 5 minutes before starting the test. Instruct the subject to put on and position the hood as before and breathe with their mouth slightly open and tongue extended. Using the nebulizer labeled Bitrex Fit Test Solution, inject the fit test aerosol into the hood. The same number of squeezes is required as was necessary to elicit a response in the threshold sensitivity screening test, 10, 20, or 30 squeezes. To maintain an adequate concentration of aerosol during the test, 1/2 of the initial number of squeezes, either 5, 10, or 15, should be injected again every 30 seconds throughout the test. After injecting the aerosol initially, ask the test subject to perform the following exercises for 60 seconds each. Normal breathing. Deep breathing. Turning head from side to side, stopping at each end of travel for 1 or 2 breaths. Moving head up and down, stopping at each end of travel for 1 or 2 breaths. Talking, reciting the alphabet, or reading a prepared text. The rainbow passage is recommended. See fitting instruction manual. Jogging in place. And finally, normal breathing again. Instruct the subject to indicate if they detect a bitter taste at any time during the test. If the entire test is completed without the subject detecting the bitter taste of the aerosol, the test is passed and the respirator's fit on that individual is judged adequate. At any time during the test, if the subject detects the bitter taste of the aerosol, the test is stopped at this point. When this occurs, the fit on the respirator on the subject is judged inadequate. If the test has failed, before retesting the subject, a 15-minute waiting period must be observed and the taste sensitivity screening test must be performed again. Test again with the same Moldex model. If the second test fails, repeat test with another size and/or model Moldex respirator. Document results of fit tests for each employee. Cleaning. Immediately after completing the test, discard any unused solutions. Rinse the nebulizers with warm water to prevent clogging. Wipe inside of the hood with a damp cloth or paper towel to remove any deposited test solution.